5 minutes on frailty. With pharmacists Tejal Patel and Sadaf Faisal. Frailty is a medical condition of reduced function and health in older adults. While the risk of frailty increases with age, the two are not the same. How is medication related to frailty?
The use of multiple medications at the same time, and more specifically taking some high-risk medications, can increase the risk of adverse effects. Additionally, as we age, we experience changes in the ways our bodies interact with drugs. These changes also increase the risk of adverse effect. Older adults living with frailty often take many medications, some of which may be high risk. Therefore, these and the changes of how our bodies interact with drugs increase the risk of adverse effect among individuals living with frailty. These adverse effects include changes in memory, dizziness, falls, and can even increase hospitalization.
Why is it important for older adults living with frailty to have regular medication reviews?
So according to information that we have available from 2016, 1 in 4 Canadian seniors are prescribed 10 or more medications. As Sadaf just indicated, using multiple medications can place older adults living with frailty at risk for adverse events. A medication review is a process whereby a physician or a pharmacist comprehensively assesses the medications an individual is taking to determine whether the medications are required, whether they are appropriate for individuals who are living with frailty, as well as to identify any other drug-related problems. These drug-related problems can be too high of a dose, too low of a dose, or persons not remembering to take their medications, or if drugs interact with each other. By performing a medication review, these medication-related problems can be identified and resolved. If required, the physician or the pharmacist can support individuals who are living with frailty in appropriately stopping high-risk medications that are no longer required. Therefore, routine medication reviews conducted by a pharmacist or a physician are extremely important.
Are over-the-counter medications and supplements a concern for older adults who are taking other medications?
People often consider over-the-counter medications to be safe for use because they are available without a prescription. Although this is true generally, they are still medications. Similarly, despite of their natural source, natural health products are also chemicals. Therefore, they can also cause side effects, interact with prescription medications, and impact the health outcomes we hope to achieve with prescription medications. Before starting any over-the-counter medication or a natural health product, it is imperative that older adults living with frailty consult with their pharmacist or physician to ensure it is safe to take these products.
What can older adults do to reduce their risk of frailty as it relates to medication?
So some things that an older adult can do to reduce their risk of frailty are to request their physician or pharmacist review their medications, and do so on a regular basis. Whenever they're discharged from a hospital, if they've been admitted into a hospital, whenever there is a new medication that's been added or discontinued, and before they start any over-the-counter medication or natural health supplement.
What work are you doing to support older adults living with frailty?
As pharmacists, there are several ways in which we're addressing medication use in older adults living with frailty. For example, I'm training other pharmacists and other healthcare professionals on the key components of medication reviews for older adults living with frailty who have cognitive impairment or dementia. I'm doing so with Dr. Linda Lee, who received funding from the Canadian Frailty Network to enable screening for frailty as we expand the memory clinic model into the Western provinces of Canada. In the past, the Canadian Frailty Network has funded projects where we've investigated medication use in individuals who are living with frailty to identify the types of medication-related problems that are highly prevalent in this population.
To learn more, visit avoidfrailty.ca.